new coronavirus testing guidelines are sparking outrage from experts. The agency now says testing is not needed for people without symptoms, even though they had been in close contact with those infected.
That's right. Tonight, Governor Newsom says California will not comply. KCAL9's Sarah Donchi has more on what the governor is saying.
The CDC once said if you come into close contact with someone who has COVID, you should get tested because of the possibility of the disease spreading, even if someone doesn't have any symptoms. Now they're saying the exact opposite of that, and that has some experts alarmed.
The new CDC guidance suggests some who have had exposure to the virus but have no symptoms do not necessarily need a test. A clear 180 from its previous stance that testing is recommended for all close contacts. That has some scientists worried.
I was certainly surprised to read it. I am concerned, and I'd like to know why the change was made.
A Health and Human Services official today denied pressure from the White House forced the change. But CBS News has learned the White House coronavirus task force was behind it. In June, the president drew criticism for suggesting the U.S. should perform fewer tests.
We test, we're going to have more cases. By having more cases, it sounds bad. But actually what it is we're finding people.
But Governor Gavin Newsom is pushing back, saying the state won't follow the new guidance.
I don't agree with the new CDC guidance, period, full stop, and it's not the policy in the state of California. We will not be influenced by that change. We're influenced by those that are experts in the field that feel very differently.
The CDC is also no longer recommending that travelers who visit COVID-19 hotspots quarantine for 14 days. But a few states are keeping their quarantine orders in place for travelers, including New York. Nationwide, cases, hospitalizations, and deaths are down, but there is a long way to go.
We're still generating 30, 40,000 new cases per day. Hundreds of people are still dying every day. That's a very high level. It's much worse than when we opened up at the end of May.
Despite the new CDC guidance, California is doubling down on testing. With the announcement of a new lab, the governor says will double the state's testing capacity, lower costs of testing, and get results back faster.
We have formalized a partnership now with PerkinElmer to build out a new laboratory here in the state of California, with PerkinElmer's capacity to provide the full supply chain in terms of the reagents and the roughly 20 different ingredients that go in to a test.
Dr. Anthony Fauci, a prominent figure on the White House coronavirus task force, told CNN that he was having vocal cord surgery when the decision by the CDC was made. Sarah Donchi, KCAL9 News.